So here are some questioning techniques. Facilitation. Facilitation is encouraging a patient to say more. So this could be a head nod and an okay. Go on, I'm listening. Reflection. Reflection is repeating patient words to encourage more information. So the patient says, oh, my chest is hurting, it's killing me. I said, okay, so your chest hurts. So that's repeating the patient words. Clarification. This is, of course, used to clarify ambiguous statements or words. Patient says, well, my chest, stomach, back hurts. Okay, could you clarify? You said your chest, stomach, and back hurts. Is there one more than the other or not? An empathetic response. Interpret feelings and responses. So I understand your chest hurts. That must be hard for you. Confrontation. So your son says your chest hurts because you drank 10 beers last night. Is that right? You can also confront them about feelings. So you seem really upset about this, sir. Is that right? An interpretation, you're going to make an inference about statements. So this is going to be, the patient says, well, I'm not feeling really good. I was out partying last night, and I have a terrible headache. So you would probably infer from that the patient had been out drinking, they probably stayed up late, and that's a good reason that they are probably not feeling so well. So those are some techniques. I'm going to move into the sample history. And if you haven't heard this before, you're going to hear it about a gazillion times in this class. Okay, so what does it stand for? S is signs and symptoms. A stands for allergies, and these could be, again, to medications, foods, or environment. Sample really is just a mnemonic for all of the things we need to ask about. So S, signs and symptoms. A, allergies. M, for medications. And this is prescription, herbals, anything over the counter, any vitamins, supplements. Are you taking them? When did you take it? What are they and what are they for? May I see them, and can we take them with us? And can we take them with us? This is kind of a loaded question, especially if your patient has pain meds. They can get upset. Sometimes they may not get them back at the hospital. What I would usually do is write down the drug name and the dosing instructions. It's a lot more work than just bottling, bagging them up and taking them with you. But ultimately, if you have the time to do it, it's better for you and for your protection as far as losing patient medications. All right, so we got signs and symptoms, allergies, medications, and P is past medical history or previous medical history. Hopefully it's pertinent. They don't tell you about, how they stubbed their toe when they were 2 years old. Hopefully it's relating to this complaint. You certainly want to encourage this. And you also want to ask and consider that the past medical history can complicate whatever it is that they're complaining about now. Someone who has asthma or COPD may have a more difficult time recovering from a pneumonia because they already have a lung condition. So we want to be sure to get previous medical history to rule out any sorts of complicating factors. So signs and symptoms, allergies, medications, past medical history. L is for last oral intake. What did you eat? What was it? Is it normal for you? And the E is events leading up to the incident. So what happened? When did it happen? Do you remember it happening? When did it start? How did it start? Did it come on strong, or did it come on, over a period of 2 weeks? How did this all start? So that was our sample history. The next mnemonic I have for you is OPQRST. So this is how we evaluate the patient's chief complaint. I'm going to abbreviate that, chief complaint. So this is how we evaluate the patient's chief complaint. O is for onset. When and how did the symptoms begin? Did they come on fast or slow? Is there anything that provokes? And I'm going to add to this palates. And this means makes better. So anything that makes it worse or makes it better. Maybe you change position, it gets worse. Maybe it gets worse when the lights come on. Whatever it is. Anything that makes it worse or makes it better. Q for quality. How would you describe the pain or the symptom? It could be shortness of breath. So how would you describe the shortness of breath? Do you have trouble getting air in or getting air out? What does the pain feel like? With this, it's key to not lead the patient. Sometimes patients have a hard time describing the pain, and in those, it's usually more of a generalized kind of vague pain. But sometimes, if you say, does it feel like a stabbing pain, the patient will be like, oh yeah, okay, sure, it feels like a stabbing pain. And that may lead you down a different assessment path. So don't lead your patient. So onset, provokes or palates, quality. R is for region and radiation. So where is the pain and does it go anywhere else? We're going to learn that sometimes we have pain that will kind of radiate somewhere or go anywhere or go somewhere else. That's especially true for like a gallbladder. People who have gallbladder problems tend to say that they have pain in their right shoulder. The gallbladder is not located in the right shoulder. It's down underneath your liver, which is under your rib cage and your abdomen. So we're going to learn a few patterns of radiation and where pain will radiate to that are significant. So we want to ask about the region of the pain and the radiation of the pain. And then severity. How bad is the pain? Or how bad is the shortness of breath? Or how bad is whatever the symptom is that we're evaluating? And then T is time. How long have you had this symptom? And tell me about, does it come and go? Is it constant? Has it been constant the whole time? Has it gotten better? Has it gotten worse? And our last mnemonic, so this is kind of goes with OPQRST, OPQRST-ASPN. AS is associated symptoms, and PN is pertinent negatives. So imagine you have a patient who's complaining of chest pain. And I use chest pain a lot in my examples, but you'll start to understand why. Chest pain, if the patient's having a heart attack, tends to be accompanied with shortness of breath, which is abbreviated SOB. It could be accompanied by nausea and vomiting. It could be accompanied by neck pain or jaw pain. These would be associated symptoms. So if I have a patient complaining about chest pain, I always, every single time, ask them, are you short of breath? Do you have any nausea or vomiting? Do you have any neck pain or jaw pain or back pain? Dizziness is another one I ask about. And asking these questions helps me determine, is this chest pain related to their heart or is it related to something else? There's a lot of things in our chest that can cause pain. But it's not always the heart that does it. So I have to kind of use my questioning to help determine, is it their heart or is it something else? So I ask about these associated symptoms. Every time the patient says, yes, I have shortness of breath, or yes, I have nausea and vomiting, that's an associated symptom. If I ask about one of these things that I would expect to see with chest pain, like neck or jaw pain, and the patient says no, then it falls into the pertinent negative category. So for each complaint, basically, that the patient has, maybe it's abdominal pain, there are going to be a set of questions that you're going to ask for kind of your other things that are going on, for your ASPN. And if it's a yes, then it's an associated symptom, and if it's a no, it's a pertinent negative. So for abdominal pain, it could be nausea, vomiting, diarrhea, and then like some of them pain on urination. So these are things I want to ask about. I want to ask about all of these things. If the patient says, yes, I'm nauseated, no, I don't have any vomiting, yes, I've had diarrhea, and no, I don't have pain on urination, then our nausea and our diarrhea are associated symptoms, and our vomiting and pain on urination are pertinent negatives. Now, some of you may have caught my brief error there. It's really associated signs and symptoms. So, signs and symptoms rather than just symptoms. So any of these things. Associated stuff with the complaint. So make sure you learn these mnemonics: onset, provocation, palliation, quality, radiation, severity, time, and then associated symptoms and pertinent negatives, as well as sample. You'll need to know those and be able to use those.